Hey everybody, it's Dr. John. I'm checking in with you guys today to talk about 5 of my top mobility drills and exercises for the low back and hips. If you're someone who struggles with low back pain and of course stiffness, this is for you. I promise you're not going to be disappointed. So bear with me. I'm going to explain all these movements and then I'm even going to show them to you, and you guys can take this and you're going to do it 2 sets. So we're going to do 2 sets, one in the morning or you can do one at night. I want to encourage you guys, you're going to be tight, you're going to be sore, but if you do this 5 to 10 minutes, invest that time every single day, I promise you in 2 weeks, you're going to thank me. So this is for my patients, and not just my patients who are struggling with low back pain and stiffness, but for anyone else who's struggling with it, because I promise you, I know my patients, they think that because I'm stretching every day for 20 minutes, I should be feeling better. But flexibility is not real protective against injury. What is how mobile your hips and your low back is. So how we're going to discuss mobility is based off function, and we want to have function in all ranges of motion. So this is what we're going to do. We're going to start this movement by standing up. We're going to get down on the ground, and then we're going to get back up and finish these movements in a standing position, just to help with the continuity and the flow. So here we go. First movement we're going to do, I call this one the elephant walk. So the elephant walk is just like this from the side. We're going to go down, down, down towards our legs, towards our feet. Good, just like that. Once I get all the way down to here, next thing I'm going to do, if you can't get down to the ground, use a block. Yoga blocks will work, anything that puts you here. And then what I'm going to do is I'm going to extend this leg back. Once I extend this leg and flex this knee forward, I'm going to feel all that tension in my sciatic nerve. And this is good for that stretching of the sciatica. And then we're going to go here, here, just like that. Nice and dynamic. I make all my moves dynamic rather than static. Just touching toes isn't going to do what this movement is, especially for that sciatic or if you're suffering from sciatica. All right, just like that. If you get real confident with this motion, you're going to do it 20 times each leg. If you get real confident, you grab under the toes and you're going to lift that toe up. So I know you can't really see it here, but you're going to lift that toe up and oh yeah. You're going to feel that stretch all the way in the calf. That's a goodie there. Just like that. Back and forth. Nice and controlled. Don't try to rush through it. The next movement we're going to do, I call these ones Goodmorning Pumps. So I kind of made this one up. It's kind of combining a good morning with a reverse deadlift. So you're going down like this. You're going to stretch. Feel the stretch. I'm not rounding my back, keeping it straight. And then I'm going to come up. And then I can even squeeze through and squeeze those cheeks through to help gain some more strength and mobility in the glutes and hips. Back down and up. Once you get confident with this, you're going to progress it by grabbing a band. And then you're going to take that band, step on it, both feet. Get the slack out of it, create some tension. And you're going to go up, down, up, down. Once again, 2 sets of these. Do it about 10 or 8 to 12 at least. 8 to 12 at least. Nice and controlled. Good. Now we're going to get down on the ground. I'm going to show you my favorite hip mobility stretch. This is called the hip 90-90. So we're 90 degrees in front, 90 degrees in back. You see my hand. If I don't put my hand down, I start to want to fall this way because of how tight it is in the hip. So I'm going to lift myself up like this with my other hand on the ground, and I'm going to try to go straight down and then stretch back. This is really good for opening up the hips. So you're going to start with the stretch. Once you get better with this movement, I'm going to challenge you to activate the legs now and these small stabilizers of the hip. So as I lean back, I'm going to lift that foot up for about 3 to 8 seconds. Remember, 2 sets each side. And I'm going to lean forward and I'm going to try to bring that heel and that foot off the ground, and I'm going to hold. I promise you, you're probably going to cramp up if you've never done this one before in the small hip muscles because they're just underdeveloped and overworked. So if you start cramping up, just get out of that movement. Good. Stretch that leg out a little bit. Even just switch sides if it's that leg that's cramping, and stretch that out too. Do a couple pumps forward. Good. And then back. And as you get good with this, you're going to start lifting that leg up and holding it a little bit longer each time. Start with 3 to 8 seconds is all I ask from you. Good. 3 to 8 seconds. And once you start getting better, you can even take this whole back leg and lift that whole leg up. But that's gonna be a lot more challenging for those small glute muscles. Okay, after that one, we're gonna move right into a windshield wiper movement. So I'm here, and I'm gonna stretch down, internal, external rotation of the femur. Just like that. Good, nice and controlled. And once you start getting really confident with this, we can even add in a shoot through. So a shoot through is like this, up, through. Good, same thing other side, in through. Just like that, you guys, good. Next thing we're gonna do is after we get done with the windshield wiper, we're gonna stand back up, and now we're gonna hit our hip CAR. So hip CARs stands for controlled articular rotations. So we're controlling that femur through the hip joint. And how we're gonna do this, I know we're all used to walking, sitting, typing, driving, walking, bending, lifting, twisting, but how often are we taking that leg through every single movement and function that it has? So flexion, abduction away from the body, internal rotation of the femur, and then extension. And when I get into extension, I even take this a step further. And don't worry, if you have poor balance, just grab something, have something to use for balance. So as you do this, you're gonna go out, in, extend. And when I extend, I really like to lean forward and stretch out this whole backside as I activate the opposite side as well. And then you're gonna come back around. So when you're here, your external rotation, adduction, and back down. So let me show you that stretch from the side that I do at the end. From here, out, in, back, and I really like to stretch forward like this. I'll even drop that hip down and sometimes open it up into a hip airplane, but don't worry about that move quite yet. Just start slow. You are gonna challenge your body. You are gonna be sore for the first few days, but I promise you, if you invest 5 to 10 minutes every single day, within 2 weeks, you'll be thanking me. Because not only are you gonna unlock some of that lost hip mobility, you're gonna take that stress off of the low back and place it back properly into the hips where it should be. You can do this once in the morning, you can do it once in the afternoon, and you can even do it once at night. I challenge you, treat it like exercise snacks at first. You don't wanna just do it all in one setting, make yourself upset and not wanna come back to it. So if you even just do one set in the morning, one set at night, I'm okay with that. It's all about progression. You have to modify certain movements sometimes to progress to where you wanna go. But if you start getting good at it, you do 2 in the morning and 2 at night, because the more you do, the faster your hips are gonna become unlocked and the faster you're gonna get better. Not just feel better, but you're gonna move better and you're gonna get better. I love you guys. Thank you for watching this, and for my patience, thank you for challenging me and calling me forward and making me make this video, because honestly, this is what I'm here for. I'm here to help as many people as I can. So if you know someone else who might be struggling with low back pain or stiffness, send this to them and let me know what you think. Any questions or concerns, drop a comment below or shoot me a direct message and I'll work with you. I'm super excited, you guys. Have a great rest of your day.